Hello and welcome. On behalf of the National Eczema Association, I'd like to welcome you to our Webinar Wednesday presentation, Mindfulness Matters by Mamta Jhaveri, MD. I'm Emily Fesler Young, a fellow eczema warrior, a techie, and a certified yoga and meditation teacher. I work to empower warriors to find their own practice, and along with Dr. Jhaveri, I push forward research on the powerful effects of meditation in relation to stress and itchiness. And without further ado, let's get our presentation started. We'd like to thank our 2019 Webinar Wednesday sponsor, Sanofi Genzyme and Regeneron, whose unrestricted educational grant has made today's presentation possible. Our presenter today is Dr. Mamta Jhaveri. Dr. Jhaveri is a board-certified dermatologist and assistant professor of dermatology at Johns Hopkins University in Washington, D.C. She completed a master's in integrative medicine at Georgetown University. She conducts research focused on integrative medicine and dermatology, including the role of meditation and herbal therapies, and has studied the role of meditation in helping chronic itch. And with that, I'm pleased to introduce our presenter, Dr. Mamta Jhaveri.
Thank you for having me, and I'm really excited to talk to all of our eczema warriors about mindfulness and how we can use that to help us get better control of our eczema. Just a brief, so my name is Mamta Jhaveri, and I work at Johns Hopkins University, and I have the pleasure of specializing in eczema and contact dermatitis. Similar to many of the listeners, I grew up with pretty moderate to severe eczema, so that's been a very big motivating factor to my career choices and how I'm involved with the NEA. And I have received a grant that helps support some of the research on mindfulness and eczema, which we'll talk about in this presentation. Similar to Emily, I'm also a certified yoga instructor and love yoga and meditation. So today we're just going to start briefly to talk a little bit about eczema and the impact on quality of life. I know most of you are already aware of this. I'm not going to go into too much detail about the research on this, but we do know throughout our previous studies in the past few years that unfortunately with chronic eczema, we see a lot of increased stress, anxiety, and attention deficit disorders. We also know that it leads to a decrease in sleep quality. So that's a few different things change in our sleep. It takes us longer to fall asleep. Our sleep duration is shorter, as well as we don't have as much deep sleep or REM sleep, which is regenerating to our body. With chronic eczema, there's also higher rates of depression. And because of that, there's also more missed school and work. And then because eczema starts at an early age, we also see a lot of caretaker stress and anxiety. So I'm just highlighting some of the comorbidities that we see with eczema because it's setting the stage for why I think mindfulness is very important in our eczema care and treatment options. So I wanted to briefly start with the itch-scratch cycle, which I know most of us are aware of. So when we feel very itchy, our innate response is to scratch. That's what our body is trained to do. Unfortunately, the scratching leads to worsening of our skin barrier. Our skin gets more dry. Irritants can get in easier, leading to more inflammation, leading to more itching, leading to more scratching. So as you can see, it's a circle. Unfortunately, it's always hard to know where things start, right? So did it start with a compromised skin barrier? Did it start with the irritants? Did it start with the inflammation? But regardless, we do know once the cycle keeps going, it gets worse and worse. And so what I want to empower you is how can we stop this cycle? So another thing I want to add to our itch-scratch cycle is stress. So stress, we know, plays a huge role in our skin and systemic inflammation, as well as how we perceive itching. So if we are very stressed, the threshold to receive our itch signal is going to be lower, so we're going to feel itchier faster. So today, we're not going to focus as much on the itch-scratch cycle, but we're going to focus on how we can address stress. So as most of you know, with the help of either your practitioner, you guys are dealing with a lot of the rest of the itch scratch cycle. You're using good moisturizers to help with the compromised skin barrier, either topical anti-inflammatory, systemic, maybe changing diet to help with inflammation. We have some cognitive behavioral therapies, or maybe we've developed some, So we probably developed some, should I start from the beginning? Can we just cut that one sentence out, or? Should I start from the
I'll
beginning?
be able to fix some of it, yeah, afterward. So you can start, wherever you want.
Sorry, the itch scratch cycle gets confusing. Okay.
You can start at the beginning of this slide if you want. That's up to you.
Okay, I might. Sorry about that.
That's okay.
Okay. So today, to set the stage for why I think mindfulness is very important for our eczema care, I'm just going to briefly talk about the itch scratch cycle. It's unfortunately hard to figure out exactly why we feel itchy. Is it initially due to our compromised skin barrier due to a genetic defect? Is it due to an increase in irritants, allergens, or an inflammation? All of that leads us to feel more itchy, and the way our brain perceives itching is it tells us to scratch. Unfortunately, even though the scratching feels good in the immediate time, it causes more inflammation, which leads to more itching and more scratching. And so one thing I want to add to our cycle is the role of stress in all of this. So I added bidirectional arrows because I know that stress directly leads to inflammation. The more inflammation we have, also the more stress we have. Similarly with stress and itching, we also know that chronic itching, chronic eczema leads to worsening stress, but we also know that stress triggers some of our eczema, triggers our itching. So it's hard to focus just on one, but today what we're going to focus on is how can we help with our stress? How can we use our mind to help decrease our itch scratch cycle and help decrease the impact eczema has on us? So let's start with focusing on what is mindfulness. So mindfulness is focusing on the now, being present. It's something that we already possess, but practice helps us access it. It's similar to practicing any instrument or any other habit in our life. The more we practice it, the better we're going to be. It is an awareness of what you're sensing and feeling without interpretation or judgment. So it might be a heightened sensation of our physical sensations, thoughts, emotions, sounds, sights, and smells. And then mindfulness helps us control our thoughts rather than being controlled by them. So for me, what that means is for my patients with eczema, I want them to use mindfulness to help them feel like they can control their eczema rather than eczema dictating who they have to be. So here, I just wanted to talk a little bit about how we can practice mindfulness. And then throughout the rest of the presentation, we're going to talk about how it might be incorporated into your practice. So there's many different ways to practice mindfulness, and I encourage you to find your own way and something that works the best for you. So the most common way would be a meditation practice. So that could be different forms of meditation, including focused attention, body scans, walking meditation, loving kindness meditation. There's also certified programs called Mindfulness-based stress reduction programs. This is an 8-week course that was created by Jon Kabat-Zinn, and he integrated Buddhist principles of mindfulness and meditation into a formalized evidence-based program. So there's many certified teachers. Usually you can go to the website and find someone near you. And this is an 8-week course that walks you through many different meditation practices so you can find one that fits you the best. Breathing techniques are also a great way to practice mindfulness. So this is incorporated into our yoga practices. Guided imagery is another great way to practice mindfulness. So that is where you are either taken through a scenery or you're envisioning a vacation. And then also I love group practices like going to yoga, tai chi, and qigong classes, or also doing some of those at home with some videos. So why should we do mindfulness? And the most important thing is we know that it helps decrease our stress. So with regular practice of mindfulness in many different cohorts, we've seen decrease in depression, decrease in anxiety, decrease in the total stress reduction score. We know that it helps us improve our self-compassion. So especially when our eczema is flaring, we tend to not feel as comfortable going out into settings, going to school, going to work. And so increasing our self-compassion helps us get over our flares easier. It also helps improve relationship satisfaction. So again, a lot of my patients with eczema tell me their eczema flares whenever they get in a fight with their spouse or their parents. And so if we can improve our relationship satisfaction, it might not directly impact our eczema flares. And then most importantly, we know that mindfulness helps improve our sleep quality. So mindfulness has been shown to decrease how long it takes us to fall asleep, improve how much deep sleep you have, and improve the sleep duration. So I know you guys already got a webinar and exhausted, but we know that all of these are already impacted in patients with eczema, so why not use our own mind to help us improve our sleep quality, which will result in our eczema improving. So a couple ways that meditation will help us with our eczema is one, with sleep. So I just wanted to quickly highlight a study done in 2015 where we saw that the more you practice meditation, the better our sleep is. So there's a randomized controlled trial comparing mindfulness meditation versus a sleep hygiene program in adults. And a sleep hygiene program is just a program that kind of walks you through all the different techniques to help us sleep better, like decreasing our phone time before, making sure the temperature of the room is good, making sure there's no lights. And there's a dedicated 2-hour program that walks you through all that. Whereas the mindfulness meditation was a similar amount of time, but it was focused on mindfulness. So when we compared the patients who either did mindfulness versus sleep hygiene, we saw that the patients that did the mindfulness program had an improvement in their sleep quality index. They had an improvement in depression and fatigue that was better than the sleep hygiene program. Both did improve our inflammatory markers, so we saw a decrease in our NF-kappa B. So the takeaway from this study for me is that the mindfulness meditation helped the adults in the study sleep better, improve their inflammation, and decrease their depression and fatigue, even better than sleep hygiene. Obviously, I still want us to practice good sleep hygiene techniques, but if we use the two of them combined, I think we can get the most benefit. We also know that meditation can help us with inflammation. So meditation decreases our systemic inflammation. So a study done at Emory in 2009 used a compassion-based meditation program, which is another 8-week course, and they measured the inflammatory markers before and after them going through a total distress score. So that is similar to the Trier social stress test, is similar to what we're going through right now. So speaking in public, which always raises our stress, even if we've gotten used to it. So what happens is they measure the inflammatory markers before or after when they did before the meditation course, and then 8 weeks after. And they saw that people who practice mindfulness during stressful situations, their interleukins didn't rise as much, their cortisol didn't rise as much, and all their inflammation was a lot better. And they also saw an improvement in the inflammatory markers the more that they practiced. So the average meditation sessions per week, so if we practice 1 hour versus 2 hours, led to a better improvement in inflammatory markers. Today, I don't want to specifically talk about how our brain receives itch, but one thing we do know in patients with eczema is that our skin is hypersensitive to receiving itch signal and reception. So we know that our skin has these tiny little itch receptor fibers, and that will send off the itch receptor to our spinal cord, and that is eventually received by our brain. I wanted to show this slide just to say that there's so many different areas of our brain that's receiving the signal for our itch. So we know that we have to process where it is, how intense the itch is. The cingulate cortex helps our brain process it and tell us, ooh, we should scratch now that we feel itchy. We also have a portion of our brain that tells us that itch is unpleasant and uncomfortable. And then we actually have a motor cortex which can anticipate itching. So if I watch someone scratching, I can start feeling itchy even if there's nothing going on in my skin. The reason I wanted to highlight how complicated it is, the brain signal is because meditation can help change the way our brain receives the itch signal. So when we use functional MRIs to look at the brain of people who've been meditating for a few weeks to months, we know that the brain has deactivation in some of the areas that were overactivated when we feel itchy. So what happens is the brain doesn't receive the signal as much. So when you feel itchy, even though the inflammation is being sent, the brain might not receive it as much, and it doesn't have to send off the signal to scratch. And meditation has also been shown to increase our gating mechanism. So the signals come from our skin to our brain, and then there's another limbic gating system, which we don't always have to activate. So meditation helps us decrease receiving the signals as well as the gating mechanism. And so what I did based off of some of this research on how we receive the signal of itching and then how our brain reacts to meditation is I wanted to see how people would react to incorporating mindfulness into their routine. So we recruited patients who have had chronic eczema and chronic itch for more than 2 to 3 years, and we didn't change any of their treatments. So they were still allowed to use all of their topical medicines, any systemic meditation. The only thing we added to their routine was then 8 weeks of a compassion-based mindfulness class. My main question for this study was, can itchy people even sit through a 1 to 2 hour meditation? And I was surprised to find that it was actually much easier for the patients than I thought, because no one complained in the class that the scratching made it so that they couldn't meditate, and they actually felt less itchy throughout the whole class. So sometimes we use an itchy qual questionnaire to see how much itching and eczema is impacting our score. So I wanted to highlight some of the scores that improved with the 8 weeks of meditation. So people didn't feel like their itchy skin drove them as crazy. People didn't feel like their itchy skin made them as angry or irritable. They didn't feel as depressed or sad due to their itchy skin. And they felt like they were able to better concentrate, and they were less frustrated and embarrassed. And some of the commentary through this program was really important and really motivational to me. So some of my patients said it was the best sleep they've ever had, and they've been suffering for eczema for more than 20 years. And the only thing we added to their regimen was the 8 weeks of mindfulness meditation. They came to a class for 2 hours once a week, and they practiced on their own, averaging anywhere between 1 to 2 hours throughout the week. I don't know how many of you felt this before, but when you feel really itchy, people usually start clenching their teeth. They feel angry towards their skin. They feel like if we could just stop itching, then we could feel better. And so one of my patients mentioned that even when they felt itchy after the meditation class, they didn't have that instant feeling of teeth clenching and anger. So they felt itchy, they noticed it, and they let the itch pass. So based off of that, I wanted to just encourage all of our eczema warriors to incorporate mindfulness into their practice, because I think it could really reframe how our eczema impacts us. I don't think, unlike other treatment options, it's not going to be an immediate fix to our eczema, but it can make our itch feel more bearable. It can make our eczema not make us impact our sleep as much and not impact our mood as much. So I just wanted to spend the rest of our talk discussing how we can incorporate mindfulness. So some of my favorite ways to encourage my patients to incorporate mindfulness is app-based practices. So some of the most popular ones are Headspace, Calm, Insight Timer, and this helps us practice mindfulness in our busy schedule. You can schedule 2 minutes, 5 minutes, 10 minutes. You could do longer sessions like 30 minutes or an hour. I do find that the app-based practices are good for starting, because it takes away the stress of having to commit an hour or two. You don't have any travel time. You can practice in the comfort of your home. So especially with eczema, I find this important because you can be in comfortable clothing. You can make sure you control the temperature. There's not going to be any irritants or fragrances, so you can control a lot of that. But I do find that some of my patients find it hard to commit to app-based practices. So that's where finding a local studio that does yoga or meditation helps too, because there's an accountability element to it. So you're accountable, you've paid for a class, you make some friends in the class, and then it makes it sometimes easier to practice mindfulness. I also encourage people to incorporate breathing techniques into their routine. So breathing techniques are easy to use when we're feeling really stressed or itchy, and they can be more of an emergency routine. So if we're feeling really itchy, if you take an inhalation for 4, hold for 7, and exhale for 8, which is called the 4-7-8 breathing technique, repeat this 2 to 3 times, your itching will get better faster than if we just started scratching and started to react to our itching. couple other ways I do some slow down breathing, especially for the children in my practice, is called square breathing. So I have them envision a square, and they inhale, which is like the top of the square, hold their breath, exhale, and then hold their breath. And that one you can just do for the same amount of time. So it could be 4 counts, 5 counts. And then if you have a yoga practice, there's yoga pranayama as well as alternate nostril breathing, which can be targeted towards decreasing inflammation. I personally like working with my local studio, so I usually go to a yoga class at least 2 to 3 times a week, and there's always already meditation incorporated into it in the mindfulness program at the end. But also you could go to a specific meditation class. And then for eczema, one of my favorite types of meditation is called loving kindness meditation. So it's an empathy-based meditation, and I feel that it is really important for us because we need to relearn how to love our skin and love ourselves while we're going through a chronic condition. And so loving kindness meditation helps us focus on people in our lives that bring us a lot of love and joy, people we might be neutral towards, and then things in our life that bring us anger and hatred, and to try to reframe that and send positive energy to it all. And I'll focus a little more specifically on that in a future slide. And then I talked a little bit about mindfulness-based stress reduction classes prior, but I do like them because they're an 8-week course and they walk you through different forms and techniques of meditation so you can find which works best for you. And then working with a cognitive behavioral therapist is really helpful with eczema because that can help us reframe how we react to stimuli. So a couple of tips on how to incorporate mindfulness is scheduling. I think it is hard to say that I will meditate when I'm feeling itchy or stressed because that's probably the least helpful time that I'll be, because as you know, when you feel itchy, it's really hard to quiet down your mind. You're getting a lot of heat in your body, you're feeling really angry, you're going to be very tense. So it is better if we could do it on a more regular time frame, setting aside 5-10 minutes. Some people like to do it in the morning, some people like to do it in the evening or before falling asleep. Especially with kids suffering from eczema, I like to have our family schedule mindfulness time. So that could be 5-10 minutes of just deep breathing together, maybe going on a mindful walk in the evening, or doing yoga stretches together. Especially with today's day and age, it's important to schedule time away from our phone, our laptops, and all the other stimuli going on in our life. And then I encourage my patients to have diaries and logs. I don't want people to be hyper-focused on all the triggers because sometimes that can create a lot of stress, but keeping a diary of triggers can help us identify, okay, my eczema flares every time I get stressed about a homework or before I'm traveling. So then we know, okay, I'm going to be traveling in 2 weeks. I might need to do some more meditation these next 2 weeks to prepare for the stressful event. We also can do mindfulness as an emergency calm. So for me, for my personal use, I actually use breathing in that moment. So if I'm feeling really angry, itchy, anxious, try to do deep breathing, and that would be my emergency calm. But I also actually have some of the apps, and they have some emergency calm meditations on there. And then meditating with kids can be challenging, but it is actually really fun and they love it. I actually remember some of my first meditation sessions when I was younger, and it really helped me get into meditation as I was older. So one of my favorite imagery to use for meditating with kids is using a balloon. So this is to help with deep breathing and just kind of using meditation to help us focus on our breathing techniques. So you pretend that your breath is a balloon, and you ask the kid to fill their belly up with air like a balloon. And you watch it expand slowly, inhale, and then as they're exhaling, you want to pretend like they're releasing air from the balloon. You can even encourage them to make a hissing sound through their nose, similar to a balloon releasing air, and that helps you get that nostril kind of pranayama breathing. And then depending on if children aren't getting into it, you can always have them picture their favorite color, picture of what kind of their favorite balloon was before, and you can also have them add movements. You can have them stretch their arms open as they breathe in and then close as they breathe out. And that helps kind of keep our attention on something else besides just our breath. There's other things we could do. So sometimes you can say that we could pop the balloon, you can gesture, so then they feel very like excited to get that big breath in because it has to be tight. And then if they pop it, they can fall down to exhale and relax. So there's a lot of ways to add fun to that. Another way that I like to meditate with kids is using guided relaxation or deep relaxation. So this is called progressive muscle relaxation technique, where you're focusing on each individual muscle. So like you'll usually start with the legs and work your way up, but you would have you take deep breaths in and focus on your right leg. And then you would address, how is my leg feeling today? Where's the stress? Where's the energy flow? Sometimes depending on the technique, you can have them tighten it and then release and send your breath there. And so then you would do this slowly with each body part. And the whole point is to help release tension and notice where we carry tension as well. And this sometimes helps us meditate and do mindfulness easier because it is focusing where our attention's going instead of just with our breath. Another way that I sometimes have kids go through guided relaxation is to pretend like their body is relaxing into the ground and melting away. So one of my other favorite meditation techniques is the compassion-based meditation technique that I talked about earlier. And I love this with my eczema patients. If you guys were at the NEA Expo, we did this together and I thought it was very moving. So this is a guided meditation where you send loving kindness to people you love, people you're neutral to, people who bring hardships. And then I usually have us focus on people with eczema. And you repeat the chant, and you can modify this in any way that feels comfortable for you. But you say, may you be happy. May you be safe. May you be healthy, peaceful, and strong. I usually modify that to say, may you be healthy and itch-free. So another way that I like to do mindfulness is through breathing with movement. So this is similar to yoga, but one specific one that I think is very easy to do at home is the cat-cow pose. So with the cat-cow pose, when you're inhaling, your body looks more like what we call the cow pose. And this picture kind of exemplifies that well, since I figured it might be hard to do it in front of you for the webinar. And then when you exhale, you relax your back, let it arch up more like a cat, and you would repeat this a couple of times. I find this very helpful for me because it's sometimes just hard to say, I'm going to practice meditation or I'm just going to breathe. And so this gives us relaxation in our lower back, our thighs, a lot of areas that we can carry tension, but it also helps us slow our breath down and then practice mindfulness with it as well. And then I don't know if any of you have participated in laughing meditation, but it's hard not to feel happy and laugh when someone else is laughing. And so laughing meditation might feel very silly, but it's actually a very effective, quick way to get mindfulness, the benefits of mindfulness. So usually with the laughing meditation, you start with stretching for 3 to 5 minutes. And then usually if you're doing it in a group setting, a teacher would guide you through this, but you would start smiling. And then you start laughing and laughing through your deep belly and making deep sounds. And especially if you're with other people, hearing them laugh will make you laugh harder. And then the goal is to do that for 3 to 5 minutes and then to sit in silence for the next 3 to 5 minutes, focusing on your breath. And that helps you kind of let the next thoughts and emotions come in. And then another thing I love to do, especially if I haven't had a chance to work out or go to yoga, is do mindful walking. So it's similar to going for a walk, except now instead of running your to-do list or kind of like, oh, I had a really stressful day and I didn't get to do this, and like now your mind's going everywhere, you're not really internalizing what you're doing outside. So the purpose of mindful walking is to walk at a natural pace. You shouldn't be speed walking. And if it is hard to just focus on walking, you can count. So you can count to 10 and then start back up at 1, or you can just, focus or say right, left. So first you just focus on walking and see how that feels for you. How does your legs feel? How do your thighs feel? And then you guide your mind through different focusing on different things. So you can focus on the sounds. Do you hear the leaves rustling outside? Do you hear the squirrels in the tree? Do you hear deer? Do you hear cars? A lot of people talking. What smells do you see? Like, do you smell the crisp air? And I feel like whenever I do mindful walking, I notice the outdoors in a way I don't every other day. You also kind of ask yourself, what am I seeing and what physical sensations are you feeling? I like this because a lot of times there's a lot of stress in our life, so it's really hard to just sit down and meditate. So this is a way to get us outside, which is very healthy for us, stay active, as well as incorporate mindfulness. And then mindful eating is a fun exercise. So usually I have people do this with a grape or a raisin. And so just to kind of recap though, we spend about 2.5 hours a day eating. But most of the time we're doing that while we're doing something else. So I can even say preparing for this webinar, I was eating my lunch while reviewing my slides. And that's not unusual for me. But so with mindful eating, it's to remind ourselves that we are eating and to do that with less distractions, to set aside time for it. So the most important thing is with mindful eating, before you start eating, you ask yourself, are you hungry? Why am I eating? And then, especially with eczema, I know there's a lot of food triggers and food that can lead to inflammation. So I'd like my patients to think about the food and how they feel before they eat it and also after they eat it. And then we want to limit distractions, try not to have the TV on while you're eating. It's okay to have people around because I do think that company helps us be happy while we're eating. And then you want to let your sensations feast. Focus on the texture of the grape. How does it look and feel? And then you can eat with your hands so you can feel it better. And then you want to eat slowly and chew thoroughly. Usually this is an exercise that we do with one or two different things, but if you can incorporate it into your daily dinner practice, it will slow down how fast you eat, which is so important to our health because our body actually releases this molecule called leptin to signal our brain that we're full, but it takes 20 minutes for our body to receive that signal. So if you're like me in a busy day, I usually am done eating lunch within 10 to 15 minutes, so my body has no way of receiving that leptin signal. So having that mindful eating, setting aside time to get away from your screen to eat will help you eat in a healthier, more wholesome way. And then another thing I usually encourage my patients to incorporate is massage. So this is something that's important for yourself, so self-massage, as well as for children with eczema. So with parents for their children, you can incorporate massage into their nighttime routine. So you can kind of dim the lights. You can use either your moisturizer or any warm oils. And then massage the skin for 20 minutes daily. This helps move our blood flow in a positive way. And it's relaxing for both the parents, the children, and it leads to improved clinical activity. So back in 1998, there was a study that was done where parents are randomized either to do this massage treatment versus just regular moisturizer. And we saw that both the eczema, the children's eczema, anxiety, and parents' anxiety improved. So I like my patients to incorporate this into their routine from day one. And we've also had studies that show that the earlier we start using moisturizers, the less severe eczema is. But I also like to incorporate this in for ourselves. So for massage for yourself, so on weekends or evenings, because this is another way to practice mindfulness. You can have some calming delta music. You can dim the lights, have a nice temperature, maybe do it after a bath to increase the amount of relaxation that we're having that evening. So hopefully today I convinced you that mindfulness is going to help us improve our quality of life when we're suffering with eczema. It can feel very daunting to incorporate mindfulness into our life, but there's lots of ways to incorporate it, and it usually only takes 5 to 10 minutes a day. It's really important not just for people suffering with eczema, but also those that are helping take care of people with eczema, because there's a lot of caregiver stress and fatigue. I hope I can encourage you guys to schedule some time to prioritize mindfulness for yourself and your family, and then look into group options near you, because I do think that accountability helps you stay active.
Thank you, Dr. Jhaveri, for an educational and a very inspiring presentation on the science and techniques of mindfulness. It's now time for the question and answer portion of the webinar. So if you want to skip to the next slide. Our first question is, when my eczema is flaring, scratching is the only thing on my mind. I can't sit still long enough to meditate. Is it necessary to sit still during meditation?
It's a great question. It really was the initial question I wanted to answer with my initial study. You don't have to sit still during meditation. So some people like sitting, some people like lying down. But like I mentioned, we can do mindful walking. You can do yoga exercises. And the important thing is it's okay to feel itchy and feel like you have to scratch during meditation. And I think that's any meditation class, they will kind of help teach you that thoughts will eventually pass. And itching is in itself something that will come and go. And so sometimes we have to just scratch while we're meditating and the itch will get better that way. Sometimes while you're meditating, you feel really itchy. If you just go back to your breath, the itch might go away on its own. A couple other things is just to make sure your skin's well moisturized before you're sitting down for your mindful practice. So making sure you use your moisturizer beforehand, any of your medications, and keeping the room temperature low. And then also just being forgiving. It is okay to feel itchy and scratching. And so the important thing of mindfulness is it teaches us empathy and forgiveness. So it's okay to feel itchy. And it's like, okay, today my practice was full, very itchy, and that's okay. Tomorrow maybe it'll be a little less itchy, but instead of feeling like we have to control how we feel, and again, every practice is going to be different. Some days it's going to go well and some days it won't, but I do encourage you to find the way that it works for you. So some people, it's important to start with like a walking practice or breathing techniques and work towards more still meditation.
Absolutely, making the practice our own and just giving it a try is a great attitude to have towards meditation. So if we skip to our next slide, question number 2. Does more meditation lead to better results? How much time and effort do I need to put into meditation to see results of any kind?
Yeah, that's a great question. We do see that more regular meditation does lead to better results, but that's more of like a cumulative. So it doesn't have to be that you have to do hours on end every day, but doing it every day is more beneficial. So in most of the studies, and I know I didn't post any of the figures, but I'm happy to quote them, but we did see improvement in sleep, and that was the improvement in sleep was related to how much you meditated, and same with the inflammatory markers. The more hours you practice during the week, the better the inflammatory markers get. And it's similar to practicing anything. So say you're playing tennis or playing an instrument, the more you practice, the less unconsciously you're going to do it. So with mindfulness, the more regularly we do it, it's more likely that we're just going to turn it on even when we don't know it. So when we're in a situation where we're feeling very angry or we're in a heated discussion or we're in class and we're feeling very stressed or at work, our mind might not escalate as much without us even having to kind of recruit our meditation. So, but there's not a specific amount of time we need to spend. So it could be 5 minutes, 10 minutes. It's just more the frequency is helpful, and also the regularity is usually a helpful thing too.
Absolutely, the routine is a definite helper there. Our next question, are there any mindfulness exercises that I can do that'll help with the itch, pain, and or stress in the middle of, say a busy day?
Yeah, I think breathing techniques are the easiest to incorporate, especially when you're in a public setting or at work or traveling. So either just deep breathing, so a slow inhalation and exhalation, or doing the kind of 4-7-8 breathing. Some of that you can do without having to step aside. Sometimes it might be helpful to close your eyes. I definitely try to do that, especially in my practice. So if I'm doing any procedures on my patient, we both do the breathing technique together. And or if I have any patients with eczema and they're feeling very itchy in front of me, we'll kind of do it together. So it's something that you can even just do 2 or 3 long breaths, and that might help reset the itch scratch cycle and kind of get you to a better place faster.
I don't know about you, but one of the techniques that I use sometimes is if I'm just going to the bathroom in the middle of the day, you know, between meetings or something like that, I can use, you know, those few moments to myself privately to practice a few breathing techniques. So just in the middle of a busy day.
It's a great idea. I also similarly also use my commute to incorporate mindfulness for me. So in the morning, to kind of keep my mind quieter, I use very soothing music and then kind of do some breathing with my driving, and then same thing at the end of the day. So the commute has to happen, so I'm kind of trying to make it something that helps me as well.
Absolutely. Well, thank you so much again, Dr. Jhaveri, for helping us to better understand the impact that mindfulness can have on eczema. Thank you again to Sanofi Genzyme and Regeneron, whose unrestricted educational grant has made today's presentation possible. And many thanks to all of you for joining us today at this Wednesday webinar, Mindfulness